Hi friends, welcome back to KPS Bio Tutorials. In the last episode we have been talking about immunology. We discussed about the different types of immunity, the innate immunity and adaptive immunity. We also discussed about the history of the immunology. And today I would like to discuss in detail about innate immunity. So over to the topic. If you are not subscribed to this channel, please subscribe and also enable the bell button so that you will get instant notification when I upload the classes. Once again, welcome back to today's topic, that is innate immunity. In the last class, I mentioned about innate immunity. Innate immunity means, as the name indicates, they are inborn immunity. That means they are already there in our body even before encountering with an antigen. And it is a non-specific type of immunity. It is a generalized type of immunity. It may act as barriers for the entry of pathogens, against the entry of pathogens. So it produces a generalized defensive mechanism against all type of pathogens. So it is not specific. Also, this innate immunity will not produce any memory of immune response. It does not keep any memory of immune response. So these are the features of innate immunity. Now let us discuss about the four types of defensive barriers which comprise the innate immunity. So the innate immunity comprises four types of defensive barriers. They are: number 1, anatomic barriers. Number 2, physiologic barriers. Number 3, phagocytic barriers. Number 4, inflammatory barriers. So, innate immunity comprised of these four types of defensive barriers. By these four types of defensive barriers, our innate immunity defends the entry of pathogens to our body. First, we can discuss about anatomic or physical barriers. Anatomic or physical barriers. They are physically preventing the entry of pathogens to our body. And they are the first line of defense against infections. These anatomic or physical barriers include skin and mucous membranes. We know our skin is a good barrier against pathogenic organisms. It will prevent the entry of pathogens to our body. If there is only a wound in our skin, through that wound the pathogens may enter to our body. If through a perfect skin, a pathogen cannot enter our body. So this skin physically prevents the entry of pathogens. And when we analyze the structure of the skin, you can see there is an outer thinner layer, namely epidermis, and an inner thicker layer, namely dermis. This is the outer thinner layer, and inner thicker layer dermis, and outer thinner layer epidermis. And the epidermis consists of several layers of tightly packed epithelial cells. Thinner outer layer, namely epidermis, is formed of tightly packed epithelial cells. And its outer layer consists of dead cells, which is filled with a waterproofing protein called keratin. The outer layer epidermis has a layer composed of dead cells and filled with keratin, a waterproofing protein called keratin. So these dead cells and keratin will not permit the entry of pathogens through the skin. So epidermis will prevent the entry of pathogens physically. Then the inner layer dermis, which is composed of connective tissue with blood vessels, hair follicles, sebaceous glands, sweat glands. So this much components are present in the dermis: blood vessels, hair follicles, sebaceous glands and sweat glands. Out of these, the sebaceous gland is associated with the hair follicles, which will secrete a secretion, namely sebum. This sebum consists of lactic acid and fatty acid. So both these acids maintain the pH of the skin between 3 and 5. This pH inhibits the growth of most organisms. Here you can see the sebaceous gland associated with the hair follicles. This sebaceous gland produces an oily secretion, namely sebum, which consists of lactic acid and fatty acids. These acids maintain the pH of the skin between 3 and 5. That is an acidic pH. At this acidic pH, the microorganism cannot grow, the pathogens cannot grow. And in this way, the sebum also prevents the entry of pathogens through the skin. So both outer layer epidermis and inner layer dermis can prevent entry of pathogens. In this way, skin acts as a physical barrier for the entry of pathogens. So it provides first line of defense against infection. Then the next type of physical barrier or anatomical barrier is mucous membrane. You know, the mucous membranes are present in conjunctiva of eye, alimentary canal, respiratory tracts, urinogenital tracts, and these structures, conjunctiva, alimentary tract, respiratory tract and urinogenital tracts, are lined by mucous membranes. This mucous membrane acts as a physical barrier for the entry of pathogens, or it prevents the entry of pathogens to our internal organs in many ways. One way is that this mucous membrane consists of many flora of microorganisms. They are called normal flora of microorganisms. The normal flora of microorganism on the physical membrane, on the mucous membrane, compete with the microbes. They will compete with the microbes entering the mucous membrane for the attachment site and nutrients. So due to the presence of this normal microflora on the mucous membrane, and they will come in competition with the invading microbes for attachment site and nutrients, and in this way the normal flora in the mucous membrane repel the invading microbes. Then another mechanism is mucus in the mucous membrane, or mucus secreted by mucous membrane entrap foreign microorganism. This mucus is a viscous compound and it can entrap foreign microorganisms, and these entrapped microorganisms are propelled with the help of cilia in the mucous membrane. So the cilia propel mucus with entrapped microorganism out of the body. You might have noticed that when some dust particles are inhaled, these dust particles are ejected out through the mucus through our nostrils. The cilia in the mucous membrane help to propel the mucus with the entrapped microorganism or dust particles out of the respiratory tract or out of the alimentary canal or out of urinogenital tracts, etc. Then the physiologic barriers. Some physiological mechanisms act as barriers for the entry of microorganisms. It includes temperature, pH, various soluble and cell associated molecules. First, upon temperature, Our normal body temperature, we have a normal body temperature around 37 degrees Celsius. This normal body temperature itself can inhibit growth of some pathogens. And we know if there is an infection, we will develop fever. This fever, that means increase in body temperature, also can inhibit growth of some pathogens. So in this way, the temperature, the normal temperature as well as the increased temperature during fever response can inhibit pathogens. Then the pH, the low pH or acidic pH in the stomach contents kill most ingested microorganism. The microorganism ingested through our food materials, when they reach the stomach has a high acidity, about 1.8 to 2.5 pH or around that. So this much acidity will kill most of the ingested microorganisms. Then some chemical mediators. The chemical mediators like lysozyme, in our tear, saliva and milk, there is an enzyme namely lysozyme. This lysozyme can cleave bacterial cell wall. In this way, it can destroy the bacteria in the ingested food materials or in the tear or milk. So this lysozyme can cleave bacterial cell wall. In this way, it can kill the bacteria. Then interferons induces antiviral state in uninfected cells. The infected cells sometimes produce a chemical messenger namely interferon, which can induce antiviral state in uninfected cells. Then collectins, which is secreted by respiratory epithelial cells, which can disrupt cell wall of pathogens. So in this way, some chemical compounds can directly kill pathogens. So these are also examples for physiological barriers. Then the phagocytic or endocytic barriers. In our blood, there is some phagocytic cells, namely like monocytes, neutrophils, and in tissues there is tissue macrophage. These types of phagocytic cells can engulf the invaded microorganisms and will be destroyed, and it is endocytosed within these phagocytic cells, and they get destroyed. These pathogens get destroyed within the phagocytic cells. That process is said to be phagocytosis. So these phagocytic cells like monocyte, neutrophil and tissue macrophages also a part of innate immunity, and it is a non-specific mechanism of defense against pathogens. Here macrophages or neutrophils or monocytes, they have no specificity towards a particular antigen, but it can take any antigen encountering with these phagocytic cells, and it will be taken up, endocytosed into their cells, and within their cells they are get destroyed. And in this way, the phagocytic cells are destroying the pathogens. So here, this is also a type of innate immunity, phagocytic or endocytic cells. And lastly, the inflammatory barriers. When a tissue damage occurs or an infection occurs, to the site of the infection or tissue damage, there will be a leakage of vascular fluid containing serum proteins with antibacterial activity and influx of phagocytic cells into the affected area. Like this, if there is an infection or damage in the tissue, numerous phagocytic cell will be influxed to that area from the capillaries, and to that side there will be an enormous blood flow, and due to this increased blood flow there will be redness and swelling. Also in that region have pain and warmth. So these four features will be the sign of inflammatory response. As a result of inflammatory response, these microbes entered through the wound get destroyed by the phagocytic cells. So inflammatory response is also an innate immunity, is a part of an innate immunity. So today we discussed about. So today we discussed about the different components of innate immunity. I hope all of you understood about the topic, and I'll be coming back with the remaining part of this topic in the coming episodes. Till then, goodbye to all of you.